The silent crisis that is growing. Heart failure is not just a medical term. It is a growing crisis. More than 6.2 million adults in the United States live with this condition, and that number continues to increase every year. Traditionally seen as a problem for older adults, heart failure now appears more frequently in younger people and disproportionately affects minority communities. According to the 2024 report of the Heart Failure Society of America, mortality rates in these groups are rising. The reality is grim. The CDC reports that approximately half of the people diagnosed with heart failure die within 5 years. And the most frightening part is that most people at risk do not realize it until it is too late. What your body is trying to tell you. But there is a hopeful side. Early detection can make all the difference. The body rarely shouts a warning. Instead, it whispers. Too often, people dismiss these signs as stress, fatigue, or simply the aging process. In reality, they may be early alarms of something much more serious. This video is not about fear. It is about empowerment. We will reveal 12 early signs of heart failure that are easy to ignore, but essential to recognize. They may not look like the dramatic chest pains you imagine, but they are equally important. By learning these signs now, you will be better prepared to protect your health and act before it is too late. And the first sign is so common that almost everyone ignores it without realizing the real danger it represents. Sign 1. The most common sign people ignore. The most common early sign of heart failure is feeling short of breath during activities that previously seemed simple. This condition, medically known as exertional dyspnea, occurs when the weakened left ventricle cannot pump blood efficiently. As blood backs up into the pulmonary circulation, fluid begins to leak into the lung tissue. Initially, you may notice shortness of breath when climbing a flight of stairs or walking quickly for several blocks. According to the New York Heart Association classification system, this represents Class 2 heart failure. What makes this symptom particularly concerning is its progressive nature. Activities that once felt normal become increasingly difficult. But what exactly happens inside your body when this occurs is something most people never imagined. Why your lungs pay the price of a weak heart. The mechanism behind this symptom involves the heart's inability to meet the body's increased oxygen demands during physical activity. When the heart muscle weakens, it cannot effectively increase its pumping capacity. This forces the respiratory system to work harder, causing the feeling of breathlessness. Research shows that exertional dyspnea is present in approximately 85% of heart failure patients at the time of diagnosis. However, many people dismiss this symptom as simply being out of shape or attribute it to normal aging. This misconception can delay crucial medical interventions by months or even years. If you find yourself stopping to catch your breath during activities you could previously complete without difficulty, this warrants immediate medical evaluation. Breathlessness does not only happen during exercise. There is a specific time of day when it can appear in an even more frightening way, and most people do not notice the connection. Sign 2. When lying down becomes a problem. Orthopnea is the medical term for shortness of breath that occurs specifically when lying down and improves when sitting up or propping oneself up on pillows. This symptom typically arises in more advanced stages of heart failure, generally corresponding to Class 3 or 4 disease under the New York Heart Association classification. The physiological mechanism behind orthopnea involves gravity and the redistribution of blood volume. When you lie down, venous blood from the legs and abdomen returns more quickly to the already weakened heart. This increased venous return overwhelms the left ventricle's compromised pumping capacity, causing rapid pulmonary congestion. Patients with orthopnea often describe the need to sleep propped up on multiple pillows, without realizing this represents a progression of their cardiac condition. How many pillows do you need to sleep? Some people adapt unconsciously, gradually adding more pillows over time. The number of pillows needed often correlates with the severity of heart failure. Clinical studies indicate that orthopnea is present in approximately 65% of patients with moderate to severe heart failure. If you have noticed that you can only sleep comfortably propped up, or if you wake up feeling like you are suffocating when lying flat, this is not normal. This symptom indicates that your heart is struggling significantly and requires immediate medical attention. Do not dismiss this as simply being more comfortable sleeping elevated. It is a serious warning sign that demands evaluation. Leg swelling may seem like something simple and not serious, but what it reveals about the state of your heart is far more serious than most people imagine. Sign 3. The swelling that reveals the state of your heart. Swelling in the feet, ankles, and lower legs, medically called peripheral edema, is one of the most recognizable signs of heart failure, particularly when it affects the right side of the heart or represents advanced biventricular disease. It is not temporary swelling from standing too long. It is a persistent accumulation of fluid that worsens over time. The American Heart Association explains that peripheral edema develops when the failing heart cannot pump blood effectively, causing increased pressure in the venous system. This elevated pressure forces fluid out of blood vessels into the surrounding tissues. Gravity pulls this excess fluid to the lowest parts of the body, typically the feet and ankles. But this swelling has very specific characteristics that allow you to identify whether it comes from the heart or from a completely different cause. How to identify if the swelling is from the heart? Cardiac edema has distinct characteristics that differentiate it from other causes of swelling. It typically starts in the feet and ankles, is generally symmetrical, affecting both sides equally, and leaves an indentation when you press with your finger, called pitting edema. The swelling often worsens throughout the day and may slightly improve after sleeping with legs elevated. Clinical studies show that peripheral edema appears in approximately 75% of heart failure patients. If you press your finger into your ankle and it leaves an indentation that persists for several seconds, this suggests fluid retention. Weight gain accompanying the swelling further confirms fluid accumulation and requires immediate medical evaluation. Have you ever had a cough that simply would not go away, even after taking medication? This seemingly simple symptom may be one of the most overlooked signs of a failing heart. Sign 4. The cough that medicine cannot cure. A chronic dry cough that persists despite treatment with cough suppressants or cold medications can be an early indicator of heart failure. This cardiac cough develops as fluid accumulates in the lungs, irritating the bronchial receptors and triggering the cough reflex. Unlike respiratory infections, this cough does not respond to typical treatments. The American Heart Association notes that this cough can occasionally produce pink, frothy sputum, which indicates severe pulmonary congestion. The pink color comes from small amounts of blood mixed with fluid, while the foamy appearance results from air mixing with excess pulmonary fluid. This specific type of sputum is a medical emergency. What most people do not know is that this same problem can cause a wheeze that doctors can differentiate from asthma with just a simple test. The wheeze that an inhaler cannot fix. Wheezing can also accompany heart failure, particularly when fluid accumulation becomes significant. This cardiac wheezing differs from asthma-related wheezing because it does not respond to bronchodilator medications such as albuterol. The wheezing occurs because excess fluid narrows the airways, creating turbulent airflow. Studies show that about 70% of heart failure patients develop respiratory symptoms, with cough being an early sign. This cough often worsens when lying down and improves when sitting up, similar to orthopnea. Although it is frequently mistaken for allergies, reflux, or medication side effects, a persistent cough, especially with fatigue or shortness of breath, should prompt a cardiac evaluation. Fatigue is probably the most underestimated symptom of all, and the reason it appears may surprise you. Sign 5. The tiredness that rest cannot relieve. Overwhelming fatigue and weakness often represent the earliest symptoms of heart failure, but they are frequently overlooked because they develop very gradually. It is not the normal tiredness you feel after a long day. It is a profound exhaustion that interferes with daily activities and does not improve with rest. The physiological basis of cardiac fatigue involves reduced cardiac output, meaning the heart cannot pump enough oxygen-rich blood to meet the body's metabolic demands. The muscles, brain, and organs receive insufficient oxygen and nutrients, resulting in the sensation of weakness and exhaustion. But what makes this fatigue different from any other tiredness is something very specific that researchers have discovered and that can change the way you interpret your own body, when the body operates at its limit without you realizing it. Research demonstrates that fatigue is present in approximately 90% of heart failure patients and often precedes other more obvious symptoms by months or years. According to the New York Heart Association classification, fatigue typically corresponds to Class 2 heart failure, making it one of the earliest detectable symptoms. Heart failure fatigue has specific characteristics that distinguish it from normal tiredness. It tends to worsen throughout the day, does not significantly improve with rest, and interferes with routine activities. Patients often describe the feeling of operating at their limit or with no energy reserves. If you have noticed a significant change in your energy levels that persists for weeks and affects your ability to perform normal activities, this warrants cardiac evaluation. There is a symptom that happens while you sleep that can be confused with a nightmare or sleep apnea, but what is really causing it may be far more serious. Sign 6. The suffocation that wakes you in the middle of the night. Paroxysmal nocturnal dyspnea represents one of the most frightening symptoms of heart failure. It is a sudden, severe shortness of breath that wakes you during sleep, typically occurring 1 to 3 hours after falling asleep. These episodes can be terrifying, leaving patients gasping and sitting up abruptly to catch their breath. The Cleveland Clinic identifies paroxysmal nocturnal dyspnea as a classic sign of congestive heart failure, representing a late-stage symptom of left-sided heart disease. The timing of these episodes is crucial to understanding their cause. They occur when fluid that accumulated in the legs and abdomen during the day redistributes to the lungs upon lying down. What happens inside your body during these sleeping hours is a silent process that few people know about, and that explains why the relief is always temporary. Why nighttime relief is a trap. During sleep, the body's natural circadian rhythms cause changes in hormone levels that affect fluid balance. Additionally, the horizontal position allows gravity to redistribute fluid throughout the body. When the weakened left ventricle encounters this sudden fluid shift, it becomes acutely overloaded, causing rapid pulmonary congestion. Research indicates that paroxysmal nocturnal dyspnea episodes typically last 10 to 30 minutes and resolve when patients sit up or stand. Relief occurs because gravity helps drain some of the excess fluid from the lungs back into the systemic circulation. However, this temporary relief does not resolve the underlying heart failure that caused the episode. Paroxysmal nocturnal dyspnea is a medical emergency. Did you know that by looking at your neck, it is possible to detect a sign of heart failure? What doctors look for in that area reveals something critical about how the heart is functioning. Sign 7. What your neck veins reveal. Jugular venous distension refers to the visible bulging of the neck veins when you are positioned at a 45-degree angle, indicating elevated pressure in the venous system. Although this sign requires clinical examination to be detected accurately, understanding its significance helps recognize the seriousness of heart failure symptoms. The jugular veins function as a window into heart function because they connect directly to the right atrium. When the right ventricle fails or becomes overloaded, blood backs up into the venous system, causing these normally flat neck veins to become visibly engorged. This represents significant cardiac dysfunction and volume overload. But there is a specific test doctors perform in this same area that confirms the diagnosis almost immediately. The liver test that exposes the heart. Medical literature from the National Center for Biotechnology Information identifies jugular venous distension as a classic sign of heart failure with high specificity, meaning that when it is present, heart failure is very likely. Healthcare providers assess jugular venous distension by observing the neck veins, while you are positioned at various angles, looking for abnormal distension that indicates elevated central venous pressure. The hepatojugular reflux test accompanies this assessment, where gentle pressure applied to the liver causes greater distension of the neck veins in patients with heart failure. This occurs because the failing heart cannot accommodate the additional blood volume displaced from the liver, causing immediate backflow into the jugular veins. Jugular venous distension typically appears in moderate to severe heart failure and indicates that the condition has progressed beyond its initial stages. The lungs hold another secret that can only be heard with a stethoscope, and what doctors hear in them says a great deal about the stage of the disease. Sign 8. The sound doctors dread hearing in your lungs. Pulmonary crackles, also called rales, are fine crackling or bubbling sounds heard through a stethoscope when you inhale, typically in the lower portions of the lungs. These sounds indicate that fluid has accumulated in the pulmonary alveoli, a condition called pulmonary edema, resulting from left-sided heart failure. The crackling sound occurs when air passes through fluid-filled alveoli during inhalation, causing them to open abruptly. These sounds begin at the lung bases because gravity causes fluid to accumulate in the lower portions of the lungs first. Pulmonary crackles represent a more advanced stage of heart failure, typically appearing in moderate to severe disease when significant fluid accumulation has occurred. As the disease progresses, these sounds spread in a way that reveals exactly how overloaded the heart is at that moment. How crackles reveal disease progression. Unlike other respiratory sounds such as wheezing, crackles specifically indicate fluid within the lung tissue itself, not airway obstruction or inflammation. In early heart failure, they appear only at the lung bases with deep breaths. But as the condition worsens, they spread upward and can be heard even during normal breathing. Although you cannot hear your own lungs, doctors pay close attention to crackles. If present along with shortness of breath or other symptoms, they signal significant cardiac dysfunction requiring immediate care. There is an extra sound your heart may be producing right now, and it can be detected before any other symptom. You will want to know what this sound means. Sign 9. The extra rhythm that exposes a weak heart. The third heart sound, medically known as the S3 gallop, is an extra heart sound that occurs immediately after the normal lub-dub of heartbeats, creating a rhythm that sounds like a galloping horse. This additional sound is one of the most sensitive early indicators of heart failure, often detectable before other symptoms become apparent. Research from the National Center for Biotechnology Information demonstrates that an S3 gallop indicates increased filling pressures and volume overload in the heart's ventricles. The sound occurs during rapid ventricular filling, when blood enters an already overloaded or stiffened cardiac chamber. This creates vibrations that produce the characteristic low-frequency sound. But what makes this sound so valuable to doctors goes beyond diagnosis and may determine which treatment will save your life. Why this sound could save your life. The S3 gallop has particular diagnostic significance because it can appear early in the progression of heart failure, sometimes before the development of peripheral edema or severe shortness of breath. Healthcare providers consider it one of the most reliable physical findings for detecting heart failure, with high sensitivity for identifying patients who will benefit from heart failure medications. The S3 sound occurs at the beginning of diastole, during rapid ventricular filling. It suggests the heart is too weak or too stiff to handle the normal volume of blood. Although you cannot detect it on your own, an S3 gallop on examination signals early cardiac dysfunction, even without noticeable symptoms. Your weight may be changing without you realizing the real reason. And this specific change on the scale is one of the most reliable warnings that the heart is failing. Sign 10. When the scale reveals what the heart is hiding. A sudden weight gain of several pounds over days represents one of the most reliable early warning signs of worsening heart failure. It is not the gradual weight gain from changes in diet or activity. It is the rapid accumulation of fluid that can add 2 to 5 or more pounds in just a few days. The National Center for Biotechnology Information emphasizes that accurate daily weight monitoring is a cornerstone of heart failure management because weight changes reflect fluid retention more accurately than subjective symptoms. Each pound of weight gain represents approximately 500 milliliters of retained fluid, making weight monitoring an objective measure of your condition. But there is a specific weight gain number that, when exceeded, requires you to call your doctor immediately, regardless of how you are feeling. The number on the scale that demands immediate action. Healthcare providers typically recommend that heart failure patients weigh themselves at the same time each day, preferably first thing in the morning after urinating and before eating or drinking. A weight gain of 2 to 3 pounds in one day or 5 pounds in a week should prompt immediate medical contact, as this indicates significant fluid retention. Rapid weight gain in heart failure happens because weak pumping causes the kidneys to retain sodium and water, increasing fluid volume. Although this initially helps, it eventually overloads the heart. Monitor your weight daily, know your baseline, and communicate sudden gains accompanied by swelling or shortness of breath to your doctor. The liver can be one of the organs most affected when the heart fails, and the signal it sends can easily be confused with a completely different problem. Sign 11. When the liver pays the price of heart failure. Hepatomegaly refers to the enlargement of the liver that occurs when chronic right-sided heart failure causes blood to back up into the liver, making it swollen, tender, and firm to the touch. This represents advanced heart failure and indicates that your cardiovascular system can no longer maintain normal blood flow patterns. Liver becomes congested with blood similarly to a water-saturated sponge. This congestion interferes with normal liver function and causes physical discomfort. The enlarged liver often causes pain or discomfort in the upper right quadrant of the abdomen, particularly when you breathe deeply or lean forward. This pain differs from typical abdominal discomfort because it is related to the physical stretching of the liver capsule by internal congestion, not digestive problems or muscle tension. In addition to pain, the congested liver triggers a series of other symptoms that directly affect your eating habits and daily routine in ways you would never associate with the heart. Liver symptoms that seem to come from the stomach. Symptoms associated with hepatomegaly include loss of appetite, nausea, and early satiety, feeling full quickly when eating. These occur because the enlarged liver presses on other abdominal organs and because hepatic congestion interferes with normal digestive processes. Some patients also notice that the abdomen appears distended or that clothes feel tighter around the waist. Hepatomegaly typically appears in advanced heart failure, often accompanying other signs such as severe peripheral edema and ascites. If you are experiencing unexplained right-sided abdominal pain, especially alongside other heart failure symptoms, this requires urgent evaluation. The presence of hepatic congestion indicates that heart failure has progressed significantly and requires intensive treatment. The last sign we will reveal is also the most serious of all, and when it appears, the body is sending a warning that cannot be ignored. Sign 12, the most serious sign of all. Ascites represents the accumulation of fluid within the peritoneal cavity, the space between the abdominal wall and the organs, and indicates late-stage right or biventricular heart failure. This condition develops when severe venous congestion causes fluid to leak from blood vessels into the abdominal cavity. The increased venous pressure from severe heart failure forces fluid through vessel walls into body cavities, with the abdomen being a common site for this fluid accumulation. Patients with ascites typically notice progressive abdominal distension that does not respond to dietary changes or gas relief medications. The fluid accumulation makes the abdomen appear bloated and feel heavy or uncomfortable. Unlike bloating from digestive problems, ascites causes persistent abdominal enlargement that worsens over time. But what differentiates cardiac ascites from other causes of abdominal swelling is a set of symptoms that appear together and require urgent action before complications become irreversible. When a swollen abdomen demands urgent action, ascites heart failure signals severe fluid overload and advanced cardiac dysfunction. It often appears alongside symptoms such as leg swelling, liver enlargement, and shortness of breath. Patients may notice tight clothing, a constant feeling of fullness, or difficulty bending due to abdominal swelling. Persistent or worsening abdominal distension requires urgent medical attention to prevent serious complications. Do not wait for symptoms to worsen. If you notice these warning signs, contact your doctor immediately. Early care can prevent complications and help you live well with heart failure.